Hi, I'm Dr. Ashford, and today we are going to be talking about hormone replacement therapy. What are the indications for it? Is this something you might need? If so, who can you talk to about this, and who should give it to you? So the first thing you need to realize is that about age 40, women do start having some very gradual decline in output from the ovaries that continues till they're 60, or maybe 65, or maybe 70. With the point being, it is a long period of time from here to not very much. Some women will drop suddenly and trail off, others much later. Either case or any case, at some point, all women drop through a threshold. Most will have some complaints of declining output, the most common two things, the hot flash night sweat thing, but they can have mood, depressed, can't think, can't remember, can't come up with a word, a name, or number, brain fog, cloudy thinking, can't sleep, go to sleep, can't go back to sleep, hair, skin, vaginal, meaning vaginal dryness, sexual, meaning libido, fatigue, weight gain. Honestly, 25 different complaints, and no one has all 25 things, but one thing or two things. The most common, the hot flash night sweat thing. So if a hypothetical woman were to say, yeah, so I'm in this age group, and a few months ago, or 6 months ago, or a period of time ago, I was at work. Unpleasant hot sensation quickly subsided, and then woke up at night sweaty. What's this? Pretty good bet she's dropped through the threshold. Therefore, it's a pretty good bet were you to give her the bioidentical supplement, it would go away. And if at the same time she says, yeah, so the hot flash thing started right about the same time, my mood and depressed and can't think, can't remember, come up with names, words, numbers, brain fog, cloudy thinking, can't sleep, go to sleep, can't go back to sleep, hair, skin, sexual interest, weight gain, fatigue. Yeah, all started about the same time. It's a pretty good bet. It's all related, and you restore where she was, it will all go away. Not always, in the sense that men have insomnia. You can't blame everything on that. A lot of it you can. So if you were to take all women, 100%, about 70% are going to have some degree of this at some point, which of course is a different way of saying about 30% never have any of it. And those are the older ladies you may know who would say, got other problems in my life. I never had any of these problems. This is like wonderful. Leave them alone. They don't need anything. It still leaves you with the 70% who do. And that's everything from, well, negligible, but I know what people are talking about, too terrible. I can't think, I can't focus, I can't sleep. I have a basket case. What is wrong with me? And everything in between, and you probably have heard all this. So the ones who aren't having any complaints, leave them alone. Negligible, probably don't need anything. The ones that are really struggling, yes, 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 and the intermediate sort of depends. So the question would be, if you are having these symptoms, who should you go see? And I would say you should probably go see someone who does this all the time. If you go to your family doctor, a lot of times they don't know about this. If you go to your regular OBGYN doctor, a lot of times they will be dismissive or say, well, just go on birth control pills, or this is not something they focus on. Regardless, if you are having these problems, you will do better, you will live longer, you will be healthier and back in the game if you are on hormone replacement therapy. It is 100% safe. Hormone replacement therapy, given in the right way, in the right dose, is 100% safe. Women will have less cancer, they will live longer and have fewer problems later on with dementia and cognitive problems if they take the hormone replacement therapy. This has been proven. There are over 100 articles on this subject just in the last few years. So my recommendation to you, if you're struggling with these types of problems, I would definitely see somebody who specializes in perimenopausal medicine and hormone replacement therapy. You could contact us at Dr. Ashford, that's drashford.com, or give us a call. This is what we do. There are lots of other good doctors, but definitely see somebody who understands this and can give you the kind of help you need. So give us a call. We would love to help you.